Dental Soundbites bonus content.
Hello, everybody. I'm Dr. Effie Ioannidou.
And I'm Dr. Arnell Wright.
We are going back to the sticky situations.
Oh, yeah.
Everybody loves this topic.
So do I.
We love this topic, right?
Yes.
I think it's a very important topic. And now we have a new guest joining us today to share their sticky situation story. Please welcome Dr. Parul Dua Makar.
Thank you. Thanks for having me. Effie.
Welcome.
I'm so glad that you're here.
Tell us a little bit more about yourself, Dr. Makar.
Sure. So I'm a general dentist, and I practice currently in Long Island, New York. And I'm here in NOLA. I'm very excited to be here.
We're glad. We've been seeing a lot of each other lately, so
Yes, we
it's good to
have.
see you again. So I understand that you have some sticky situations that you would like to share with our audience. And would you go ahead into that story and then tell us how you responded in that moment?
Sure. So one of the most recent ones I had was, when a patient runs late and it's going to throw off your entire schedule.
Yeah.
And we had a patient running late, and we're all like, come on, where are you? We're calling her. She's like, well, I'm on my way. She comes in running, and, we could see that she was really distraught.
Yeah.
And, she's like, I'm so sorry, I'm late. I just had an emergency. And we're like, okay, what's the emergency? My parrot died. And, you think that this is something somebody made up, you hear all stories. But no, legit, her parrot died who'd been with her for 15 years.
Oh, wow.
And her daughter played with it. They used to hang out in the basement, let the parrot free, and she was totally distraught. Her father gave her something that he choked on, and he died of suffocation. So it's pretty tragic. And her daughter was a mess, and she was upset. And I said, okay, what are you, we just heard her out.
Yeah.
And I said, what are you doing with, what's the next step? And she's like, well, we're getting it cremated. I'm like, okay. And then what? She's like, I don't know. I'm like, all right, here's an idea.
Okay.
Take the ashes and, if you have a plant or something, just sprinkle the ashes, and it's a living thing, and it's giving you another purpose, and your parrot's always with you. And I think in that situation, she was just so distraught and just needed to be heard and validated that her feelings were real.
Yep.
Even though they may be insignificant, it's not a person, it's an animal, but animals are very special to us.
Yeah, people care about their animals.
Yeah. And so we walked her. There was a lot of tears and all of that. And, and we carried on the day. And, she came for her next appointment. She's like, it was such a great idea. I did it. And I feel so much better. Yeah.
But such a nice perspective that you offered to the patient. First of all, you showed them you cared,
Yeah.
you listened, but also you gave them this kind of spiritual dimension of the significance of the ashes.
Yeah.
So,
Yeah.
I mean, it's very, very, very nice.
Yeah, we've connected over that too, though.
Yes,
We've had
there's a
many
magic.
moments. Yes, there's a magic.
So you want to hear something fun?
Please.
I got off to NOLA here in New Orleans, and I got my Uber. And guess what my Uber driver's name was?
No.
Gabrielle.
Really?
Like the angel, right? There's always
Wow.
magic around you.
I love that.
Yeah, this
Wow,
is
wow, wow.
amazing.
Yeah. You're a periodontist, correct?
Indeed.
So I have a periodontist.
I'm a wannabe.
And you should be. Is there anything you can't do?
I shouldn't say this on a live recording, but hey, we're here now. Keep it.
Yes.
So I have a periodontist that comes to my office.
Okay.
And he did a surgical extraction. And right after that, we placed a bone graft.
Okay.
And a lot of my stories, crazy stories, are post-COVID. And I think there's a lot of emotional and mental trauma that happened to people.
Sure.
And so anyhow, the periodontist did a surgical extraction, bone graft on a third molar, and the patient left perfectly fine, happy.
Yeah.
I would say at the end of the day, she comes back in with her husband, who is throwing a fit. I mean, he's like, what did you do? Why did you do a bone graft on her? I mean, this is an adult patient. She consented. We went over everything. He's bringing us all this research from the internet, how we have shortened. She's not going to live up to 90 because we put this bone graft and she's going to die, and it's all our fault because we did a bone graft.
Very legitimate. A graduate of the University of Facebook.
Yes. I mean,
I was not expecting that.
and he's like screaming in the front office, and I'm getting the periodontist, I'm like, okay. And we have other patients,
Yeah.
right? We have patients, and you get distraught patients in the front office, whether it's for insurance or payments or schedule or something or the other. So we're like, and the wife is in the back giggling. So we're like, okay, she's fine. We just need to, again, feel the patient being heard.
Yeah.
And so we're like, okay, come on to the back. Let's show you what we did, so to eliminate him screaming in the front.
Yeah.
And, brought him into the operatory, pulled up the x-rays. We're like, this is all the information. This is the graph that was placed. And your wife will be fine. She's fine right now.
Yeah.
She just needs to heal. And we promise she'll get to celebrate that 90th birthday
Ooh.
together.
But isn't
That's
it
a big
interesting that he came back to he came to
Yeah.
practice to speak on
Yeah.
behalf of his wife?
That
Yeah.
happens a lot though in practice. That happens to me a lot where it's like the significant other is doing all of the talking. And sometimes it's not even at the initial consultation. And so
Yeah.
it's like the aftermath where the other person has to like stick up for the other person.
Right.
And it's like they're kind of like it's like 2 against 1.
Yep.
So you have to be prepared, right?
But can I ask you, when we consent the patients
Yeah.
and when the patients, sign their name,
yeah.
the forms that I do, and I'm sure what you do as patient in the
Sure.
medical
Sure.
setting,
Yeah.
you are supposed to declare an alternative
Yeah.
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 decision
Always.
maker,
Right,
right?
mhm.
Yep.
And if this portion is blank,
Mhm.
nobody else has the right to discuss your treatment plan. So I wonder if, of course, you don't want to alienate the patient, and of course, you don't want to come up aggressive, but I wonder if, the right approach is we hear you, but we have
This
to
is the
discuss
patient.
this is
Yep.
the patient.
I do take that approach
right?
sometimes.
Yeah.
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 I do. Yeah.
And, she came by herself. So he wasn't around. This was post when she went home and told him, like, this is what I got done. And
Interesting. I wonder how frequently we see the reverse, like the wife to come in and be aggressive, protecting the...
not as much, but I see it with the
No.
moms.
The moms.
Yeah.
With
The
the
moms.
20-year-olds.
Yeah, no.
Yeah.
With the 20-year-olds, yes.
Which, again, adult, right?
Adult, yeah.
Yeah.
Yeah. We understand when they're little kids, of course, and we always have the option that if you want to come see your child in the back, sure.
Yeah.
Because you always hear stories. And, but yeah, for adult patients, their parents intervening sometimes,
Yeah.
it's a little tricky.
Very
It's
tricky.
sticky.
I hear you.
Yeah.
People are not easy.
Yeah, very not. No,
Yeah.
like very
Yeah.
not. Not at all.
Very
not. Oh, we gotta keep that. Oh, maybe bonus. I don't know.
I love
Oh,
this. But anyway, two very interesting stories.
Yeah.
Yeah.
Good.
And it's all about, being a patient-centric office.
Yeah.
Caring for the patient,
Yeah.
not an insurance, not to meet a quota for the day. And as long as you do the right thing for the
Yeah.
patient and they care,
Yeah.
that you as a practitioner are caring for them,
Mhm.
your practice will grow. You
Yeah.
will grow and it will be organic. Yeah.
All right.
This is a very nice statement to close with.
I
but
think so.
thank you so much for being here.
Pleasure. Thank
it was
you.
really nice to listen to your
My girl.
stories.
Yep.
And tell us where our listeners find you online.
So online, on my website, parulduamakar.com, or Instagram, I'm at Dua Good Job, DUA.
Oh,
Yes.
do a
Name?
good job.
Isn't it amazing? That's so amazing.
Yeah, a pun off my maiden name. You
Yep.
know, I'll give my credit to my late brother, but yes.
Yes.
Yeah.
That's
really
great.
Well, we're so glad you were here. Thank you for being
Thank
here.
you.
Thank you.
Bye, everybody. Thank
Bye,
you so much
everybody.
for listening.
Dental Soundbites is an American Dental Association podcast. Learn more at ada.org/podcast.